to share our clinical trial with you. The first line clinical trial of the autologous CD7 CAR T cells for patients with the relapsed and refractory acute lymphoblastic leukemia or the lymphoma. Disclosure. Lymphoblastic leukemia lymphoma and the NK cell lymphoma are highly aggressive hematologic malignancy, which has a poor survival. The disease underscores the need for better therapeutic strategies. This is survival for the patient with TALL, LBL, categorized as early, systemic, and mature. In order to improve the treatment of the TALL, LBL, and the NK cell lymphoma, we aimed to CAR T therapy. We found out the positive rate of the CD7 express was the 96%. CD7 is a transmembrane glycoprotein expressed by T cell, NK cell, and their precursor. CD7 expressed in TALL is highly stable at diagnosis, relapse, and during chemotherapy. Chimeric antigen receptor T cell have achieved remarkable clinical responses in B-cell lymphoma, but the treatment of T-cell lymphoma is silent. What's the reason? Unlike in B-cell lymphoma, the development and the clinical application of CD7 CAR T therapy in TALL or the LBL still face serious challenges. CD7 is present in both lymphoma and normal T cell, leading to CD7 CAR T cells attacking each other. The residual lymphoma cells in CAR T cells may be resulting less eligible products. The transient reduction of the normal T cells is associated with the increased risk of opportunistic infection. In vitro cytotoxicity and cytokine relapse assays showed that when at E2T was 2 to 100, there is a highly killing rate, more than 60%. Meanwhile, interferon gamma interleukin-2 can be increased. PDX model demonstrated that CD7 CAR T significantly improve mice survival. CD7 CAR T eliminated tumor cells in spleen, BM, as well as a significant decreased tumor burden in liver and lung. After having overcome the difficulties, we conducted the clinical trial. That's a single-arm, open-label clinical trial. This is register number 4637. This is study design and procedure. This is the demographic and the disease characteristic for 5 patients. 2 patients received prior transplantation. CD4 and CD8 expression on patient's tumor cell is a negative, but was the positive in CAR-T product, while CD7 expression in patient tumor cell was the positive, but was the negative in CAR-T product. Efficacy evaluation, we can see case 1 achieved CR, case 2 CR, case 3 CR, case 4 CR, case 5 PR. But the time of the follow-up is short for this patient. Grade 3 out of 4 adverse events: febrile neutropenia, white blood cell decreased, lymphocyte count decreased, platelet count decreased. Pharmacokinetics, CD7 CAR-T cell expression by FACS and by qPCR. Pharmacodynamics, the red line stands for the CD7 positive cells. The black line stands for CD positive abnormal cells. Case 2, case 3, case 4, case 5. Cytokine release after CAR-T infusion. We can see the case 1, case 2, case 3, the interleukin-6 level increased. But in case 4, interleukin-10 level increased. And in case 5, interleukin-10, interleukin-2 level increased. PET-CT emergence. Case 3, before therapy, 1 month of the treatment later, 3 months treatment later, the tumor disappeared. Case 4, before therapy, a month treatment later, the tumor disappeared. Case 5, in right breast and the left breast, there were tumor. But 1 month after the treatment later, the tumor size was reduced by half. Summary, the CD7 CAR-T cell showed superior therapeutic efficacy. 5 patients achieved 100% ORR. The CRS grade is generally low. Only 1 patient died due to abdominal infection. There was death caused by tumor relapse or the disease progression. No obvious T-cell aplasia was observed during follow-up of the patients, which may be related to the proliferation of the CD7 CAR-T cells in vivo at an early stage and the presence of CD7 negative CAR T cell at a later stage. In one word, the CD7 CAR-T therapy with demonstrated manageable toxicity is effective in the treatment of RR-TALL or LBL and NKTCL. Acknowledgements. We sincerely thank the patients who take part in this study and their families, friends, and caregivers.